I am honored to be here. I came to WashU 2013. I was the opportunity to do transdisciplinary research when we were one school. I am even more excited to do transdisciplinary research in the new School of Public Health. What I want to do today is just kind of walk through a certain line of work of ours that emphasizes the transdisciplinarity of this work and the community engaged work that we do. So I'm going to apologize in advance. I'm giving too much information. Oh, hold on. I need to act like I'm talking and not getting my picture taken. So apologies in advance. This is my job talk. I think I already got the job. You can't fire me, so there's that. What I'm going to do is give some context around homelessness. I'm going to go through a handful of empirical projects that we've been doing here in St. Louis with our partners. Above the red bar are the pictures of our community partners that we have engaged with for years and years and years. In the middle bar is the colleagues and students who really contributed to this specific work that I'm talking about. And then below the bar is kind of recent collaborators, recent graduates, and a team of doctoral students who really make this fun. What I want to do is just kind of, I've had so much fun in this work. I just kind of want to show you it. Okay. Guess what? Homelessness is not good. And it's getting worse. So this year, it's actually 2024, the last year we have data, we reported the highest count of homeless people. In any given night, there's almost 1 million people who are in shelter or on the streets. That's not counting an estimated 20 million households who are a day away from losing their housing. We anticipated a rise in homelessness during COVID. We built a simulation model that showed that this is going to happen. Rent accumulation, rental arrears accumulation has long-term effects. And we know that it's just immeasurably bad for people and communities. Everywhere has a problem. So there's no community in the country that's not trying to address homelessness. And it's not equally distributed. It disproportionately burdens people from underrepresented backgrounds. For example, Black Americans make up 13% of the population. They make up 40% of the homeless population. And even among homeless populations, minoritized groups experience the worst kind of homelessness. So trans folks are way more likely to experience unsheltered homeless than being able to get and stay into a shelter. I am tired of publishing studies that show that homelessness is bad. We know it's bad. It gets under the skin. And even worse, it unwinds the social network of families and communities. So we take a very dynamic, multi-level perspective that when we allow homelessness to occur, it's a failure. We also show repeatedly that if you can prevent homelessness, good things happen. So again, just study after study showing how different programs can prevent homelessness with good outcomes. One set of works suggests that every dollar you invest in homelessness prevention, you get a return of $28 across other public health systems. So it's a smart investment. We've built simulation models based on community engaged work. These are group model building sessions that we did with local homeless people and homeless providers to build a simulation model to look at what works to end homelessness. And guess what? Our current policies don't, and prevention does. So we know this from all sorts of empirical inquiry. This message has taken off in other places. So Canada invested $25 million. It was there, like, if NSF, NIH, and the Department of Energy were one thing, they awarded $25 million to design and test youth homelessness prevention initiatives. And we did some simulation work to support that. Our simulation work was instrumental in the economic response to COVID. The St. Louis City and County received about $40 million for rental assistance, emergency rental assistance. We worked with community partners to identify ways to maximize those resources. This was fun. So Jason Purnell, our colleague, started the regional response team right during COVID. We were building models about what the fallout of COVID was going to be in April of 2020. So we had to think, like, how long is this going to last? How big is the economic impact going to be? It turns out we did a really good job, because we continue to update these, and they're consistent with observed trends. More recently, we've been working with the United Kingdom government, their HUD equivalent. They've also invested $25 million to design and test homeless interventions, especially preventative interventions. They're using randomized trials across the country. And last month, again, we built them a simulation. And this is a dashboard that we presented at HUD, or not, at MHC, they just changed their name, so that they could use a simulation tool to both think about what they wanted to try and how they would need to evaluate whether it was worth the investment. So there's a heavy emphasis on prevention in this work too. Here, things are not so good. Our biggest policy initiative around homelessness was an executive order that essentially wants to institutionalize homeless people. There is a lot of uncertainty. So the partnerships that we built over the last decade almost, this has been the hardest time, even COVID included. But it's also been bad before COVID. So I spent a year as a fellow for an HHS agency charged with the responsibility of designing a system that would prevent youth homelessness. And I gave them a report, and they embargoed it. They weren't willing to do it. It was against the priorities of the then administration, and it basically would cost too much money. So they just never saw the light of day. Okay. I think part of this is because homelessness is so complex. The homeless system is an array of services ranging from preventative services like one-time rental assistance or utilities assistance, to emergency shelter for those who need a house immediately. It also includes longer-term supportive housing that provides both housing and some case management. Every community in the country offers the same array of services, and every community in the country does this differently. So underneath the basic framework of the homeless system, there is a network of local agencies that are charged with the task of coordinating with each other to identify the best way to respond to homelessness. Homelessness is emergent. It changes. The needs of homeless people change and communities change. So it's highly collaborative. It's much like lots of public health responses. It's dynamic. Okay. Thank you, Matt Kruder. You can tell us how bad how bad the problem is. This is from 211 counts. You can see the top blue bar is the number of calls requesting housing and shelter. It's the largest bucket, and it's a lot, and it's been a lot for a long time here in St. Louis, and similar to other countries or communities. Currently, and we've gotten better over time, there's only 500 families who can't get shelter who are on the streets in a month. So what our providers are doing is just facing a forest fire, and they're running in and they're trying their best, but there's just such demand for help around housing that they can never keep up. And they're forced to do things like this. Pick who gets a service. Which one? Why? This is where we started our partnership with our local partners. We were interested in this space. So underlying this is this set of problems called, there's scarce public resource allocation problems. The gist of this has been studied in social work and in political science and public policy. The idea is that when there's not enough of a public good to go around, you need to think carefully about how you're going to allocate that. And these allocation decisions are essentially ethical and moral decisions. So common ways that this occurs, so if you think about liver transplants use a MELD score, and it essentially is the sickest person gets the liver first. So the neediest first, or vulnerability approach. That contrasts with several other schemes. One of them we use in the doctoral system, in our doctoral program, where we just find the best students, we pick them because we know they're going to do great, and we can take credit for it. That's how we do it. We are maximizing the post-outcome gain. That is a different allocation strategy. A third one that is particularly interested to us is this benefit or outcome orientation. We use this in things like emergency rooms or the kidney exchange, where it's not necessarily the sickest person who gets a kidney. It's the person who we expect to benefit the most from the kidney. That is different. It's not neediest first. It's some sort of assessment and prioritization. This is where we started. So in 2016, I think, I met my colleague, Sanmai Das, who was in computer science at WashU at the time. And he was working on I'm not going to use the word again. Algorithmic fair kidney exchange. So how do we make the started meeting weekly. And we actually haven't stopped. We've met pretty much every week since 2016. The tools that computer science and AI bring are lots, but the ones that we were most interested in is this prediction and optimization. These are the underlying components of precision targeting. So if we can predict who's going to respond best to an intervention, we can optimally allocate our scarce resources. So with a little machine learning and some systems decision rules, you can make your healthcare system better through precision medicine. You can make your public health system better through precision public health. We were thinking before them how to do this for homeless services. And what we were committed to is this idea of responsible AI or participatory AI, where it's an explicit acknowledgement that AI is not neutral, and it requires careful design, implementation, and testing. And in this process, you have to engage with end users. Again, because these are ethical, moral decisions. So you need to talk to people and you need to come to consensus. So what the argument that I'm going to make today is that AI does present opportunities for efficiency gains, and we can actually be more equitable by designing our AI systems that are meant to target. We are getting explicit about the ethical decisions that we're making, and we can also measure the outcomes of those decisions. Okay, so first project published across a series of AI outlets. I was doing some background work, gaps analysis for them at the time. Met Sanmai, my collaborator, and we approached them about how could we do this? And we didn't know. This picture is published in the Journal of American Medical Informatics, something, was the culmination of what we did. And what you see is that it's a circle. So essentially, we elicit input from the community partners about priorities. We look at the data. We feed back what we see in the data to our partners, and then we consider implementation. It's a participatory approach. So we used the administrative data from the homeless system for a 3-year period. We looked at about 10,000 households who received 10,000 first-time enterers into the homeless system who received one of these services. This is the standard set of services that every community offers. You can see how distributed they are. So prevention, there's a lot of people who get prevention because it's cheap. There are fewer people who get some of the more expensive interventions. And ideally, everyone gets something, but not necessarily. So there are thousands of households who are not in this table. So the data that we're using are first-time entries who got a service. You could look at this and say, oh, the prevention is good because it has the lowest reentry rate. We define reentry as coming back and asking for help within 2 years. So people are less likely to ask for help in prevention, but they're getting prevention because they're in better situation than someone who's on the streets. This raises these counterfactual problems that all of us deal with. And we wanted to think carefully about whether and how we could use the data to target. Can we identify who's going to respond best to one of these interventions? The features, so the data that we had, 10,000 households, 37 variables. They were all collected at intake. They covered demographics. They covered housing experiences, like how many times have you been homeless in the last 12 months? Are you chronically homeless, meaning have you been homeless for 2 years? All sorts of information at the household level, de-identified, just so you know. And our goal was to predict who is most likely to need help again. Key point and a cool thing about this data is that we are able to see if people ask for help, not just whether they got help. Because this is a scarce resource, if we only knew the people who got help, we would be really biasing our insights. So for this data, we know just did they call back, essentially. Okay. State of the science, machine learning at the time. It's a Bayesian approach. We're predicting the probability of reentry given the allocation of every service and all the features, all the intake features. What this means is that we're addressing this through a counterfactual approach, where for every household, we know what they received, we know their outcome. What we don't know is what would happen if they received a different intervention. What the Bayesian method is doing is trying to get at the best prediction of what would have happened if they got a service. So in this example, the person got whatever interventions on top. They could either re-enter or not, 0 or 1, or 1 or 0. And we know that outcome. Then we can estimate a probability of what would have happened if they got a different intervention. And every household then has different set of probabilities. This is a method that had been applied in computer science and some social sciences, but it fit what we needed to do. So 2 big things that it did is it gave us predicted probabilities at the household level. We're not just getting population average effects of any given service. We're getting household level predictions of how they would do. And if there's variation in that, that's when optimization would work. That would mean that some households could have done better had they gotten something else. That's the precision and the optimization components of what we were trying to do. This is actually the data. This is the first 5 rows of a synthesized data that we used. What you see, so just to nail this down, so every row is a household. So we know the actual services they received. We know whether or not they re-entered. And then we have predicted probabilities of what would have happened if they got the different intervention. You can see that individual 1 had a high likelihood of re-entering regardless of what was received. Individual 3 had a low likelihood regardless of the service. And individual 5 would have done better with supportive housing. They actually got rapid rehousing. Again, we trained this model, we tested this model, we evaluated the accuracy. 1 point of accuracy, credibility, when we had the model predict the outcome given the intervention the person actually got, we were right 99.99% of the time. So we had a high classification rate. Our AUC, ROC curves were okay, 0.8, so decent. Now that we have these individual level probabilities, we can throw them into an optimization algorithm. We can tell the optimizer to minimize reentry, minimize system-wide reentry into homelessness. Oh, but you can't. Because if we just said minimize reentry, it might not do that fairly. It might just say everybody who is a certain color gets the intervention, or it cherry picks. So instead of just minimizing and optimizing, this is when we went back to the community partners and we said, who do we need to protect? And through a design workshop, we identified a core set of household groups that the system needed to prioritize. So we plugged those into the optimizer as constraints. First thing, actually, we first look at, okay, so the community is telling us it's these groups we need to protect. Well, do these groups actually benefit? Are they doing better in any given service? And what we found was that actually, most of the time not. We knew that if someone was eligible for prevention, they always did great in prevention. So easy. We knew that households with comorbidities, mental health, substance abuse problems, always, or on average, did better in supportive housing. And we knew that families with children under the age of 18 did better with rapid rehousing. It's a short-term rentals property. The other priority groups, there was no effect. So trying to optimize something that doesn't have an average treatment effect, it's not going to gain you any efficiencies, and then it opens the doors for those inequities that we're trying to address. We didn't have data on LGBTQ plus at that time, so we couldn't look at that. Okay, so long story short, through our process, we developed a set of simple decision rules that HomoService developed and could use to allocate their services in a way that, in theory, would be more efficient. And in fact, they were more efficient. So we gained we saw a 5% reduction in system-wide homelessness. That sounds small, but that's the best that any intervention in the homeless literature has ever done. We're good at preventing single households from becoming homeless, but at the system level, the community-wide level, 5% is a big effect. We also were able to mitigate an observed bias in the data, and we avoided exacerbating or creating biases in the data. So we had efficiency gains, equity gains, in a very transparent process for applying an AI into homeless services. Okay, now you want to know, did it actually help? So what happens when you give caseworkers the predictions? That's not as simple as you think, because people are people. When they see risk predictions, they react to it. They ask, is this what the system should do? Is this what I think should be done? What are these risk predictions? What do I think about AI? All of this gets combined. So we're really curious about what would happen if caseworkers implemented this. Federal policy changed, and they changed the system, the way that households were assessed. We couldn't implement any of this. So it was a big disaster. So instead, we pivoted to an online experiment. So this is just lay people. We wanted to use lay people because there was a rollout of a new policy. It was a vulnerability-oriented policy, serve the neediest first. We were worried that caseworkers they're going to jumble this. We needed lay people who didn't know anything about decision-making in homeless services. So implemented a survey where essentially people saw a series of tables like this, and they were asked, who do you prioritize for services? We randomized whether people just saw this information or they saw that information plus these risk predictions. And we were curious how this would work. What would that do? Would that change the way people make decisions? Okay, so this is a little confusing, but okay. So through a clever experiment, we were able to, I still can't believe this actually worked. When we went in, we thought, you know, I bet there's two types of people. One who want to do vulnerability first, and one who wants to maximize efficiency, outcome-oriented. And it turns out there's two types of people. Half of them want to do vulnerability first, always. Half of them want to do outcome orientation, always. So this is a graph of the just baseline. What you see is the y-axis is just outcome orientation. There's two bars because there's two groups. They're vulnerability oriented and they're outcome oriented, and they're 50-50. When you give risk predictions to outcome oriented people, it makes them more outcome-oriented. When you give risk predictions to vulnerability-oriented people, it makes them say, screw you. It makes them more vulnerability-oriented. So, this is, if we had implemented, we very well could have led to this unintended consequences, but it opens the door to all sorts of, like, this stuff is hard. Like, it's not just developing an algorithm. It requires lots of thinking and planning, and it doesn't always work the way that you want it to work. If we had implemented this, we could have made things worse. Okay, so this gets us to this idea of street-level bureaucracy, a word that I can't say, like algorithm. Seminal work by Lipsky in the early 90s, talking about the common scenario where we have public resources being allocated by caseworkers who have a lot of discretion. And a knock on street-level bureaucrats is that they can bias, they can cheat. They can say, I like you and I don't like you, so you're getting something and you're not. And we know that this happens. But on the other hand, there's also a wisdom that accumulates from working with people. And that wisdom could actually make these street-level bureaucrats better. They could, like, be able to read between the lines, and they couldn't tell you why they're going to offer this person assistance, but they do because they know it just is going to be better. So we were interested in this in the sense that, like, so I mean, it's coming. AI is going to replace a lot of street-level bureaucrats. They are growing. They're easy to build. Requires no thought anymore. They're going to be making decisions. So we wanted to see what would be lost. And we called this the bureaucratic counterfactual. So we have services now that are not AI allocated. How do we do if we implement AI? So we did this in two ways. So the first way used explainable machine learning. So this is another fair AI application where, the big knock on machine learning is, or large language models or whatever, is you put in some information and it comes out. You get a response and you have no idea how that decision is made. There's, in fact, recent work that is trying to take the veil away. And essentially the way that we did it in this work is that we required the algorithm to use simple rules for decision making. We didn't allow them just to use all the data in all the ways. We only allowed them to do 4 tiers of decision making. I'll show this in a second. Okay, so we did explainable ML, and then we also did my favorite part, what we called the Doge Boys project, where we gave LLMs information and we asked them to make a decision. Okay, so explainable ML. So here's one really, really interesting insight right off the bat. We were able to learn how caseworkers make decision with high accuracy. So AUC, ROC curves of for prevention, it's 0.98. What that means is that these caseworkers are making decisions consistently. They are consistent in their allocation of services. How that would translate into a street bureaucracy is that these bureaucrats are procedurally equitable. They're treating everybody essentially the same. By using explainable ML, we can also look at how they're making these decisions. So this is a example of a decision tree for supportive housing. When we just kind of read through this decision tree, so you probably can't see this. The orange buckets are the people who get supportive housing. And who they are, they're consistently younger females, and then males who are asking for help a lot, they're repeat callers, and younger low-income males. So not just younger females at any income, but younger lower income males, which seems reasonable. That seems like a good strategy. For shelter, you can't see this anyway, but it's low income callers who call a lot and evicted women. Just to point out, like we gave the data to the algorithm, and the algorithm was told, make a guess on what service this household's gonna get, but only go 4 nodes deep. And they could do it with 90%, 95% accuracy. Here's another really interesting thing. So we also probed who got, so what we did was we looked at when caseworkers did use discretion. And we defined that as they got a service that was different than what they were predicted to get. So if I was supposed to get shelter, and 95% of the time I get shelter, what about those 5% that got supportive housing? What happens? We looked at two things. We looked at the household's vulnerability, and we measured this by just looking at risk factors. Turns out caseworkers only use discretion for low vulnerable households. They are rolling the dice on households who are lower vulnerability. And when they use discretion, they are getting better outcomes for supportive housing. So they are looking at a person saying, you probably should get shelter, but I think you would do better in supportive housing. And when they do that and they make that decision, there's lower chance that they're going to come back into the homeless system. I think this is fascinating. So this is what would be lost by eliminating street level bureaucracy. There is wisdom here that's being applied. I'll skip that. Okay, Doge Boys. This was a project, we actually presented it in Spain a couple weeks ago at the AI Ethics and Society conference. It started right around January when the Doge Boys were doing the Doge Boys. And if you don't know, what they were doing was they were putting all the data into a large language model and making decisions based on that. There's a term that gets called vibe coding in this world, where it's just like, this large language model seems cool. Let's just give it data and see what happens. And they're not caring about, how the model is trained, what the model is trained to do. Let's just do this. Let's just throw it in there. So we were literally afraid that this was going to happen in homeless services. And so we wanted to get ahead of it and say, what happens if you do this? We used 2 large language models, Llama and DeepSeek, with new data that was collected after the federal policy that ruined my wonderful line of research, where they, instead of using first come, first serve, they started using vulnerability first, and they measured vulnerability through an assessment. And so those households, if the highest score gets the first available spot. The nice thing about this is that we could clearly see what the system goal was. The system goal is to give the most vulnerable people the available resource. Okay, so if large language models could be used, they would need to be internally consistent. We'd want them to make the same decision over and over. We'd also want them to align with the system goal, which is vulnerability first. So we're able to use this score to see. Really what we needed the LLM to rank order the households, because that's how the homeless system does it now. There's highest score down to the lowest score. LLMs are really bad at ranking. So we had to trick it, but we did it. We tricked that LLM and generated what essentially is a ranking of scores. And all we did was we prompted the LLM repeatedly. We gave them essentially that table that you saw. And we said, which of these two households should get this scarce resource? One important thing is that these were local models, so none of this went into the cloud. So it limited the large language models that we could use, but we used two models, Llama built in the US, DeepSeek built in China, some very interesting variation there, they're not the same. We had the LLMs give us their rankings twice so that we could see how consistent they were. Okay, do you know the answers? Does anybody want to guess? Okay, do they make the same decision over and over and over? No, they do not. Spearman correlations were around 0.15, so small. Do their decisions correlate with what would be decided by the vulnerability score? No, and you get opposite results when you ask the two different models. So it was around correlation around 0.1 or negative 0.1. So no. We wanted to give them the benefit of the doubt. Maybe they match these smart street level bureaucrats. Maybe they're doing the same as bureaucrats. They're not. When you predict decision making, you get an AUC of 0.5, which is 50-50. So implementing LLMs is to make homeless service decisions is it's random. It's just random. Okay. So here's what I've talked about so far. Here's what I've talked about. I'm not going to make you stay here all day. Okay, so I still believe in the power of participatory AI. I do think that the design process and the ability to evaluate any decision making is super powerful, and I think it adds to what we in public health do. So I am a believer in this, and I recognize and I experience that this is hard. It's not easy to do. It requires patience. It requires deep partnerships. There's a lot of trust built in this work. It requires sitting at the edges of disciplines and being able to talk different languages. I do know one thing. Computer scientists, they like to optimize. Any problem can be solved with optimization. Just get an objective function and you're good. But besides that, I don't understand most of the stuff they talk about. When we are in the mode of implementing these tools, we really need to think about the incentives that we're creating and whether we want to create these incentives. So again, the role of evaluation and equity checks is key. And I think we should be doing this. AIs are coming, the Doge boys are gonna be here. We need to get ahead of this. We need to know how to do it better. Okay, so last point. Yes, I know that we are rearranging the deck chairs. That the real cause of homelessness is structural. It's decades of housing discrimination and minoritization of people. It is fueled by an affordable housing crisis. That's why we need a yes and. We can gain efficiency and equity in the homeless system, and we need strong research, strong advocacy for upstream initiatives. And if I had another hour, I would talk to you about some of the homelessness prevention that we're planning using technology. So on that, I am going to acknowledge our funders and say thank you. Do I get to call on you? Oh, sorry, I don't get to call on you.
Oh, so sorry. Do you want to start? Sorry, Susie. Great presentation, Patrick. Two things. So the first one is just procedural question, because I realized, and I've been told, when we say AI, people usually just assume LLMs. I assumed from like people who are not as knowledgeable as you on the topic. From the reentry project, it seems like it wasn't LLMs. You were using other machine learning processes. So I just wanted to confirm.
Yes.
Okay, great. The second question is, so it was really interesting. I think we discussed fairness when I was interviewing here. So this is related to fairness. I think in LLMs, we were thinking about fairness, we're thinking about anti-classification, classification, or calibration. So it's interesting when you said we talked with stakeholders to identify vulnerabilities, and there, I wasn't sure what did you mean by vulnerabilities here? Is it that we think those people are going to have worse outcomes? Is it just we think they just had they have a harder life, and that's why we need to prioritize them? And why did you go with that approach? That was interesting to me, given our fairness conversations.
Yes. Two great questions. So yes, we were using machine learning for the first part, and then only the last part did we use generative AI or large language models. And just to point out, there's a lot of advancement in machine learning too. So we were using state of the science machine learning for the middle part of the talk. Okay. Okay, so how did we come up with vulnerability and why did we choose it? This is a little complicated, but so really what vulnerability is just give it to the person who is most likely to re-enter homelessness. And you could do that by looking at, making guesses about, combination of risk factors like, oh, they're chronically homeless, they're more likely to. So the reason that we chose it is because it's the most common allocation strategy in these scenarios, neediest first. It also aligns with our current homelessness system priority, neediest first. A point that I did not make, but we also had to create metrics of equity. So when I said that we addressed equity, we measured it in a few different ways. We looked at, for example, we looked at what happens when you are, if you are allocated the intervention that works best for you, what happens when you're allocated the intervention that looks worse for you? And we used that nuance to build equity metrics that are not being discussed in the AI fairness literature, but it's complicated. Yeah.
Very cool stuff. Thanks, Patrick, for this talk. I'm really interested in the social workers, I'm assuming, or whoever was assigning where folks would go, and the wisdom that you talked about. So I'm really interested in how we capture that wisdom, and if we can ever get to the algorithms, the yes, no. I think there's just missing pieces.
Yeah.
And how could that help the large language models? And I'm also very interested in if we have the right places yet. So like, are there two missing pieces? Could this eventually work and we're just not there yet?
Yeah, so interesting aside, we submitted a grant, Sanmai, me, and Sanmai's mom. So Sanmai's mom is a anthropologist at Hopkins. What we wanted to do was do ethnographic work to watch caseworkers make these decisions. Because the idea is that all of this wisdom, this nuance, it's not in the data. Like we can see that they're consistently making decisions and we can see the outcomes of their decisions, but it's not necessarily getting coded in the data. And we wanted to see if we could get at that, and if we could use that to design better assessment strategies. I think where we are now, I think there's the ideal of where we will be and the practical. The practical is I'm pretty sure we're not going to do anything different besides use risk scores. And there's not a lot of interest in AI in homeless services, at least. Ideally, we would be doing that kind of design for every decision-making strategy, where we are asking caseworkers, how are you making these decisions? What information are you looking at? What are these conversations you're having? What character? So to do it really, really well, it would require an archaeological dig.
Sorry, I've got a question from online. To what extent could reliable homeless services and shelter utilization data lead to bias in AI's model predictions, considering that people of color individuals may be less likely to use these services due to mistrust?
Yeah, so it's a great point, and that was I mentioned the change in federal priorities where they broke the system. We no longer know all the people who are asking for help. We only know the people who are getting services. So that was a huge blow. They wouldn't are Black. And it's 60% women. The groups that I'm most concerned about and the community is most concerned about are LGBTQ plus, and the people who are chronically on the streets. Those are the ones that we're not able to engage with, and it is a data problem, but it's also just we need to do this job better. We need to create services that are more inclusive and available. That's the other thing is people learn. It's crazy when you look at the call data. Like Matt, you probably know this. Like at 8 a.m., homeless services get all of their calls, and then they get them at noon, and then they get them at 5. And it's because that's when the providers are going through what availability we have. The people don't know this, but they learn it. So it's super tricky. Okay. Yep. Thank you all. I appreciate your attention.